Welcome back to our channel. Today we're diving into the Capricorn trial and its impact on treating patients with acute myocardial infarction, or MI, and left ventricular or LV systolic dysfunction. Does Carvedilol reduce mortality in these patients? Let's find out. In patients with acute MI and evidence of LV systolic dysfunction, treatment with Carvedilol is associated with decreased mortality. Beta blockers have been used extensively in MI treatment for decades based on early randomized controlled trials, or RCTs. However, these studies largely excluded patients with heart failure. The Capricorn trial, published in 2001, addressed this gap by investigating beta blockers in patients with acute MI and reduced LV function in the era of reperfusion and ACE inhibition. The Capricorn trial randomized 1,959 patients with stable MI, reduced LV ejection fraction, or LVEF, of 40% or less, and on ACE inhibitors to receive either Carvedilol or placebo. With a mean follow-up of 1.3 years, the trial aimed to assess all-cause mortality and cardiovascular hospitalization. The trial included patients aged 18 and older with MI within 3 to 21 days before randomization and LVEF of 40% or less. Key exclusions were uncontrolled heart failure, need for inotropic therapy, and significant comorbid conditions. While the primary endpoint of all-cause mortality or cardiovascular hospitalization was not significantly different between groups, Carvedilol significantly reduced all-cause mortality alone. The figures were 12% versus 15%, with a hazard ratio, or HR, of 0.77, p equals 0.031, and a number needed to treat, or NNT, of 43. It also lowered cardiovascular mortality, 11% versus 14%, HR 0.75, P equals 0.024, and non-fatal MI, 3% versus 6%, HR 0.59, P equals 0.014. Based on Capricorn's findings, both the American College of Cardiology, or ACC, and the European Society of Cardiology, or ESC, guidelines were updated. Beta blockers, particularly Carvedilol, are now recommended for patients with acute MI and reduced LV function, reinforcing their role alongside ACE inhibitors. The trial is a landmark study, providing crucial evidence for the benefit of beta blocker therapy in acute MI with LV dysfunction. It underscores the importance of including beta blockers like Carvedilol in post-MI treatment regimens, especially in patients with reduced LV function. The Capricorn trial's findings led to updates in both ACC and ESC guidelines. Beta blockers, particularly Carvedilol, are now recommended for patients with acute MI and reduced LV function, reinforcing their role alongside ACE inhibitors. This trial underscores the importance of including beta blockers in post-MI treatment regimens. Despite its strengths, the Capricorn trial had limitations. The primary endpoint didn't achieve statistical significance. The trial was underpowered for some secondary outcomes. There were also concerns over the initial endpoint change from all-cause mortality to include cardiovascular hospitalizations. In summary, Carvedilol significantly reduces mortality in patients with acute MI and LV dysfunction, reinforcing its role in contemporary cardiac care. Thank you for watching. Don't forget to like, subscribe, and share for more medical insights. For more details and references, check the description below. Stay tuned for more updates on medical research and practice.